Ever pondered how prevalent rheumatoid arthritis is or the impact it has on the lives of millions worldwide? Today we'll unravel the mysteries of this chronic disease, often simply referred to as RA. Rheumatoid arthritis is an inflammatory autoimmune disorder. It's systemic, meaning it affects the entire body, but it primarily targets the joints, causing pain, swelling, and eventually destruction of the joint's lining, known as the synovium. The result can be deformities that significantly impact a person's quality of life. But RA doesn't stop at the joints. It can manifest with what we call extra-articular features. These include rheumatoid nodules or lumps under the skin, and even pulmonary fibrosis, a lung disease that results in scarring, making it harder to breathe. The risk of developing rheumatoid arthritis increases with age, and it predominantly affects women. The reasons for this are still under research, but hormonal, genetic, and environmental factors are thought to play a role. Diagnosing RA is a clinical process, which means it's based on symptoms and physical examination findings. However, laboratory tests and imaging studies can provide supporting evidence. For instance, blood tests may reveal the presence of rheumatoid factor and anti-citrullonated peptide antibodies, markers often found in those with RA. Imaging studies such as ultrasound can show signs of synovitis, inflammation of the synovium. As the disease progresses, X-rays may reveal bone erosions and joint space narrowing. While there's no definitive cure for rheumatoid arthritis, early intervention can make a significant difference. Disease-modifying anti-rheumatic drugs, or DMARDs, can prevent disease progression and RA-related disability. These drugs are used in what's known as a treat-to-target strategy, designed to achieve a specific goal, such as remission or low disease activity. To summarize, rheumatoid arthritis is a chronic, systemic, inflammatory autoimmune disorder that primarily affects the joints but can manifest with extra-articular features. It's more common in women, and the risk increases with age. The diagnosis is clinical, supported by lab tests and imaging studies. And while there's no cure, early intervention with DMARDs can prevent progression and disability. Understanding RA helps us empathize with those living with this disease and motivates us to continue researching and developing better treatments. After all, knowledge is not only power but also the first step towards change.